I've been practicing medicine for a long time. I graduated from medical school in 1978. I've been here at the Cleveland Clinic for more than 20 years, actually 22 years. And my practice has actually evolved a lot. I see patients often for second, third, and fourth opinions who have controversial, difficult issues. Perhaps they've been recommended to have bypass surgery or a stent placed and they're not certain if it's the right thing to do. And they're looking for someone who is pretty independent and who will, tell them what they ought to do and why. I firmly believe, and it's one of the principles that I practice under, is that people have a right to know. And so we have a frankness with patients. We tell them what they're up against. We are open and honest. If their life is threatened, we tell them that. We tell them what we're going to do to get them through that illness. And we found that it's often more reassuring for patients to know the facts, even when the facts are pretty serious, than to be guessing about what's going to happen. Patients are always the most interesting part of care, because everybody's an individual, and getting to know your patients and their families and understanding their concerns and addressing them is always the great pleasure of medicine. But I frankly derive pleasure from all of the components of what I do. I love teaching our postgraduate fellows and our residents, trying to impart the same values in them that I hold so dear. I also greatly value the research opportunities. New discovery, developing new therapies is something I'm very passionate about, spend a good deal of my time doing. Some people might describe me as a crusader. There have been a few times in my career when I have battled with some large pharmaceutical companies over the safety of their drugs. I'm willing to take the heat and stand by my convictions, and so far I think we've largely had a positive impact, but there's no question that some people get rubbed the wrong way by the kind of passion that people like me bring to the debate about the direction that we ought to go with healthcare, with pharmaceuticals, with medical devices, and with public policy.